Hi, my name is Dillavou. I'm a vascular surgeon here at Duke University. I primarily work at the Duke Regional Hospital, where I am the Chief of Vascular Surgery at that location. At Duke Regional and at Duke University, we teach both our general surgery residents as well as our postgraduate vascular fellows and our integrated vascular fellows. So I'm lucky enough to be exposed to all three. I came here in 2015 from the University of Pittsburgh, and I can say that in the last 5 years, I've really grown to know and love Duke University. In thinking about how Duke is different from other places that I've been, I think that the focus on the entire general surgery residency is really remarkable. In so many places, it feels like the Department of Surgery is fragmented and that there are so many small divisions and factions that have their own autonomy that it's easy to lose sight of being a big part of general surgery. Here at Duke, we have a combined M&M conference, we have combined grand rounds, and all of the general surgery residents rotate through the major specialties and divisions. And so that's something that I really value here because I think it all keeps us focused on the same things. When I think about the Duke residents, I'm always impressed. I've worked at several different institutions, and I can honestly say the Duke residents are the cream of the crop. They are smart, they are motivated, their hearts are in the right places, and they all want to be fantastic surgeons. And so I think the kind of person that does well at Duke is that kind of person that just has a thirst for surgery. And that means technically, that means clinical knowledge, that means research, and whatever it is you're interested, you'll have so much opportunity here at Duke. Some of the best faculty are here, and we just can't wait to work with you and figure out how you're going to make the contribution to our field. Here at Duke, I am the Chief of Vascular Surgery at the Regional Hospital. And what that means is at the Regional Hospital, which is a small, used to be county, then it was a community hospital, and now it's one of the Duke hospitals, we have a lower census and probably a lower acuity than they do at Duke. But the upside is we're very busy, and I am in the enviable position of doing a very high volume vascular surgery service, and I really see myself as one of the people who teaches residents how to do vascular surgery and anastomoses. People rotate through during their intern year, and now as a 3, and sometimes as a 4 and a 5 as well. But usually it's that experience during their 3rd clinical year where they do literally 4 to 8 anastomoses a day with me, and they get really good. And that is a role I cherish. And I really feel like that's my main contribution to Duke surgery. So I have to say that when I came here in 2015, I did not know how much I would and wouldn't work with the Duke residents. As it turns out, working with the Duke residents every day is not only a big part of my job, but it's actually the best part of my job. And what I enjoy most about working with the Duke residents is the chance to see them grow. I have a very high volume service, and most of the residents when they start with me have done very little, if any, vascular surgery. And by 1, or if I'm lucky, 2 months with that resident, they have gone from timid and unsure to having a really good skill set and being ready to really do vascular surgery and anastomoses. And that's just so great to watch people gain that confidence and also to see them carry that confidence into wherever they end up going. I know not everybody does vascular, and that's fine, but to just have that technical aha moment is really fun. In vascular surgery, I feel like we have a very collegial relationship between the attendings and our fellows, both the 5-2 fellows and our integrated fellows and the general surgery residents who are rotating on our service. I think all of Duke faculty is very respectful to the residents, and I think the residents are just terrific. They work so hard and they want to do the right thing, and they do the right thing. And so this creates an atmosphere of mutual respect, and we all take that very seriously. Down from Dr. Kirk down to, the CMAs who are helping us put patients in rooms. Everybody takes that respectful relationship very seriously, and I guess that's how I would best characterize our relationship with the trainees. I really love living down in the Research Triangle area. My favorite things to do in Durham are to hang out with my kids and go to the parlor and get ice cream. Some of the best ice cream you're going to have, and it's just delicious. We get it every time we can.